So, Dr. Tammy, like, I think you'd be best to explain it. The difference between hospice and palliative care, because up until a few years ago, I was confused about it. There's a reality of clinical difference, right? Which I don't know. Is that so different? I'm curious how you would describe it. And then there's the business side of things, because there is from a business side of things difference. So what is your interpretation of that difference? Because the legal definition versus like what it really is in practice it can be ambiguous.
Okay, so the legal definition of palliative care is those patients who had a chronic or terminal, potentially terminal illness who still want to pursue aggressive measures. So this would be someone who has cancer and they're on chemo, but they have pain associated with that treatment. They have nausea and vomiting associated with that treatment. So the word palliation is typically defined as to abate symptoms. And so palliative care will come in and take care of the nausea, take care of the vomiting, and take care of the pain, all while that person continues to pursue treatment. Hospice does the same symptom management, but when you are hospice criteria, when you're assigned to hospice, you have elected to no longer pursue aggressive treatment. So the thin line in the sand is care is the same between palliative care and hospice. Both services will manage symptoms. The line in the sand is, are you wanting to continue to pursue aggressive treatment, or are you saying no to aggressive treatment? In my opinion, the palliative care is a stepping stone for hospice. A lot of times family members and patients are not at a point where they can accept a terminal diagnosis. So even though the disease, if it progresses on its current trajectory for the next 6 to 12 months, we anticipate that person transitioning to death. That could be the same criteria for palliative care. It's just that the family and or the patient aren't ready to basically say, I accept that. So we offer them palliative care to allow them to continue those aggressive treatments, even though the prognosis is the same 6 months to 12 months if the disease continues.
Yeah.
And so that's why Dr. Gary was mentioning it's a thin line, because the care is the same. It's just where that patient and their family are in accepting that terminal diagnosis.
So on the business side, bring it up, palliative care is more accepted by the HMOs because it's a huge money saver for them, because they're able to hire somebody like us, have us, like Dr. Tammy said, manage all the symptoms, deal with everything that usually the patient has to deal with in the family, but for a fraction of the price. You know, we've had cases where the HMO will push on a healthcare provider to keep the patient on palliative care just because the patient's family doesn't want to hear hospice, which is ridiculous. And it kind of ties our hands in how aggressive we can be with the comfort care and treatment. And at the end, the patients are not receiving the care that they could have just because of that little technicality. Dr. Gary said, when you elect hospice, as I think, in my opinion, is when you can actually, in today's environment, more or less take control of your own healthcare, where you're saying, okay, I've had enough. I know this is happening. Let me just enjoy the last month, 6 months, a day of my life where I know I'm at home with my loved one. I'm at a boarding care. I'm at a nursing home. Wherever they want to be, we'll set up whatever they need. Again, so that on the business end, that's kind of where I see the difference between palliative and hospice. But again, on our end, on the clinical end, it's kind of the same.
Yeah.